the Trump administration's drastic cuts to the U.S. Agency for International Development, USAid, and its retreat from global public health initiatives are jeopardizing the containment of Mpox, formerly known as monkeypox, transforming a manageable situation into a potential global emergency, according to aid workers and leading global health experts. This alarming development underscores the perilous consequences of prioritizing political agendas. The World Health Organization, who declared Mpox a public health emergency of international concern last August, spurred by a surge in cases within the Democratic Republic of Congo, DRC, and its rapid spread to neighboring African nations. U.S. aid played a pivotal role in combating the virus, deploying its resources to implement crucial vaccination programs, enhance testing capabilities, and bolster surveillance efforts on the ground. In 2022, a collaborative effort between USAid and the Centers for Disease Control and Prevention, CDC, channeled a significant $55 million in emergency aid towards this vital cause. However, a substantial portion of these allocated funds remains unspent, effectively frozen by the administration's sweeping directive to halt nearly all humanitarian aid. This unprecedented freeze, imposed amidst a global health crisis, has left aid workers deeply demoralized and significantly hampered their ability to effectively combat the disease. U.S. aid workers intimately involved in the Mpox response have voiced their profound concern, describing the situation as one of widespread loss and uncertainty. The abrupt cessation of funding has effectively stalled critical programs at a critical juncture, leaving the ongoing battle against Mpox. The 2022 global Mpox outbreak, resulting in over 100,000 confirmed cases across 122 countries, marked an unprecedented event, the first instance of the disease spreading beyond Central and Western Africa. While the outbreak has largely been contained, and case numbers have significantly dwindled, this is largely attributed to the timely and effective implementation of widespread vaccination programs, many of which were supported. The administration's actions now directly threaten the sustainability of these gains. While Trump administration officials justify their actions by citing a need to curtail wasteful spending and combat fraud, public health researchers vehemently criticize the swiftness and intensity of these cuts, highlighting their devastating impact on global health security. The erratic nature of these cuts, implemented with minimal consultation or consideration for the potential consequences, further fuels concerns about a lack of strategic foresight and a disregard for international collaboration in addressing public health emergencies. The freeze on U.S. aid programming remains largely in effect, creating an atmosphere of uncertainty and jeopardizing the agency's future. Ongoing legal challenges are further compounding the situation, adding another layer of complexity to an already precarious situation. A recent federal court ruling temporarily halted the aid freeze, mandating the government to reinstate funding within 5 days. However, aid workers remain deeply skeptical, fearing that this temporary reprieve will be short-lived and that programs may be abruptly terminated again in the near future. This uncertainty further undermines efforts to effectively combat Mpox and other pressing global health challenges, adding to the sense of widespread despair and demoralization amongst those working on the front lines of this crucial battle. The long-term consequences of this reckless disregard for global health security remain to be seen, but the immediate impact is undeniably devastating. The lack of consistent and reliable funding undermines trust, erodes morale, and ultimately threatens the lives of countless individuals in vulnerable communities, showcasing a profound disregard for human life and international responsibility. The situation underscores the urgent need for a more responsible and sustainable approach to global public health funding, one that prioritizes collaboration, transparency, and the protection of vulnerable populations. This crisis highlights the critical need for a fundamental shift in the approach to global health initiatives, fostering a greater commitment to sustained funding, robust partnerships, and strategic collaboration, safeguarding global health security against future threats.